Hi Sheila, how are you?
Good, how are you?
I'm good. Thank you so much for being here.
You're welcome.
First of all, congratulations on your
Thank
pregnancy.
You so much. Thank you.
Is this first baby?
No, actually, it's babies number 2 and 3.
Babies number 2 and 3, okay.
So let's get into how you have kept healthy in your second pregnancy.
Yep, second, yeah.
Have you done anything differently to your first pregnancy in terms of keeping healthy second time round?
To be honest, in my first pregnancy, I was pretty healthy. I was going to the gym more or less every day until he was born. I think this time round, I'm more focused on what I'm eating and what I'm actually putting in my body, like products, hair care, and like the products we use around the house and stuff. I'm looking more into like non-toxic stuff, just for everyone's well-being, to be honest. But yeah, that's I think the biggest thing, and I'm obviously still in the gym every day.
Every day?
Every day.
Wow.
I'd say that the main thing I've tried to do this time is be more active. So I try to work out it's only once a week.
No, but that's good.
But
really good.
Yeah, it's better than nothing. And I think I go to gym classes, right? And I love them. I hate going, but once I'm there, I'm happy that I've went. I feel stronger. I do things that are weighted and strengthening and things like that, or Pilates for stretches, because it's like full body stretches. But one thing I found is that because I've been through childbirth before, I just realised the strength that's required. And the thought of doing it with 2 babies makes me think I need to be as strong as possible, if I'm honest. So,
have you had any guilty pleasures in pregnancy in terms of food, indulging, anything like that that's like really made you happy?
That I'm still eating now, because I've had to give up a lot of stuff. Coffee was so sad to give up. So sad to give up. It was one of the saddest days. Like, I crave a coffee every day, but I had to give it up.
I had to give up plantain. Yeah, it made me feel, in the first pregnancy, fried plantain like really made me like,
so sad.
and to this day, and plantain chips, and to this day I don't like plantain chips, and I can just about tolerate fried plantain now. Like,
That is so
it really changes.
sad. I'm sorry. Because fried plantain is the best thing ever. As if you had to give...
I don't really love it anymore.
The love's gone.
yeah, I'm quite conscious of the foods just because of the guidance.
Yeah.
So I have not had like salmon, which is something I loved before.
Me too, yeah.
I actually really want like an eggs royale, or eggs benedict, whichever one it is, with the salmon and like the poached egg. Yeah, I can't wait to have that.
One of the things that we want to talk about today in terms of keeping healthy is vaccinations and vaccines. So I had the whooping cough vaccines in both pregnancies. The RSV vaccine wasn't around when I was pregnant with my kids. Have you taken the vaccines, or are you planning to take the vaccines? Yeah.
So I actually work in healthcare with children, and I've worked in the last 15 years. I've worked with kids with heart and lung conditions. I currently work with kids with breathing conditions, and I've seen those actual viruses and what they can do to children and what they can do to families. So 100% I'll be taking all the vaccines. It's actually a blessing now RSV is available to pregnant women. It's only been introduced September 2024, but I've known it in the capacity where I've been giving it to children from birth to 2 years of age, of children that have high risk conditions, because the risk of RSV to someone that's vulnerable is really real. And like I said, I've seen kids in hospital beds, you know, life or death, literally. Healthy ones and those compromised with RSV.
I've had the whooping cough vaccine. I did that because I think I did it both times, if I'm honest. So I knew the benefits of it. I knew that it would protect the baby, and babies in this case, from developing whooping cough when they're born, having trouble breathing, all of that. So I did my own research once I was offered it, and then I just decided that was something I would take. And yeah, it's been fine. I just realised, or I guess weighed up the options and realised that the benefits of having it outweighed the risks. And there weren't any risks for me, so I was willing to.
Yeah, and I always say whooping cough is not just a cough, it's a cough that they say lasts 100 days. So even after treating the bacterial infection, one of the complications is that they can be coughing and have like breathing difficulties for up to 100 days afterwards.
And there's nothing worse than seeing your baby ill, honestly.
Nothing. I can't sleep. I always tell them I can't sleep because just the level of stress, and it's just not worth it. So, I
wanted to know, what was your experience like of getting vaccinated? I can't remember if I did mine at a pharmacy or a GP, because I also had the flu one, so I can't remember.
Yeah, I think it depends what vaccine you get, where you take it. They, like I said, they pretty much was just like, oh, you need to have this vaccine at this time, book an appointment, and that's it.
Yeah.
That's literally all I got.
Pretty quick.
Yeah, it's pretty quick, but as an informed person, that's fine for me, but what if I wasn't that person?
Yeah, true.
When I had the whooping cough, I was fine for like a day. The next day, my arm was dead.
It's the next day. You don't get it that day. It's the following
So after,
day.
and then it's like I'd wake up with my arm feeling almost like numb, and I was like,
I
what's
forgot
happening
that I
to
even
me?
had it. I was like, what's happening? But then
Literally, I started
realised.
telling my sister, my partner, I was like, something's happening to my arm.
Yeah, and they're like, oh, didn't you have the vaccine?
Yeah,
And I was like,
oh,
oh yeah,
yeah.
that explains it.
So why do you think it is that people in our community are so hesitant when it comes to vaccines?
I think it's obviously multiple different factors. I think one of them is the fact of historical injustices. So this will mainly be the fact that there's been a history where our people have been experimented upon in terms of medications and not been given treatment when treatment was available, just to see what would happen. So I think there's a lot of mistrust in that way. And also we also know that there's still ongoing inequalities in terms of treatment that we receive from healthcare providers and access to treatment as well. So that's something I definitely noticed. Another thing I would say is that just misinformation and how easily it spreads in today's generation. We have social media, we have WhatsApp messaging where someone can give an anecdotal story and everyone takes it as gospel, and especially if you have any sort of doubts already, just when you hear from your friends, community leaders, pastors or other sources that something could go wrong, people automatically just take it as gospel and just reinforces any doubts that they have. So these are the reason why I think we have these issues.
Like I say, working in healthcare, and I have for the last 15 years, I think you can really and clearly see where the system isn't designed for Black people, and not just in pregnancy but in all cases. So if you already feel like the system isn't designed for you and you don't trust that healthcare system, you're not going to access it and engage with it. When I talk to my patients, I'm not going to sit there and talk jargon and they're not going to understand. I'm going to talk in a way that people will understand and make a decision where they're happy with what they're making a decision about. Because it's easy to fling a leaflet at someone and just say, do it. That's not the way to do it. So having representation that they can relate to, you go to your GP and you go to the practice nurses, and yes, there is a large minority community working there, but majority of the time there isn't. And can you relate to that person? You have to have people to relate to, and it's like in any culture or in any family situation, if you can't relate to it, you're not going to engage.